My most sincere thanks are due to Dr. Matthew, Dr. Muthappan. In fact, he came to invite me personally last month, and the other organizers of the Trivandrum Alumni Association, ATMG. I was wondering why not we call it AKMG rather than ATMG, because that will be a better term, I suppose. That's only remark. The topic for us today is obesity. That is one of the burning problems in all over the world. That is the topic of the day, I thought, probably. For various reasons, obesity is on the increase all over the world, especially in children, and India as well. You will be surprised to know it is on the increase, probably after Punjab, more obesity in Kerala. I'll go to those details later on. Before going to the topic proper, I would like to mention to you about what are things we do in Lord's Hospital as the minimally invasive surgery. Now, going to some of the, I have behind my room these two photographs. Obviously, I don't have to tell you who it is. He gave us freedom in the land, on land, and he gave us freedom in the sky. Mannilum minnilum ennu parayile. That's why I keep these two people so important. I don't go. We started out Lord's in 2000 April, and Lord's means patient is our Lord. We have several highlights. I'll mention few of them. We do the weight loss surgery extensively. The latest mini gastric bypass and sleeve gastrectomy. Those are the two things I believe is the operation that is going to stay on for some time to come. And then we do quite a lot of RFAs for varicose veins. One of the beautiful procedures in varicose vein. We do it through a tiny needle, and I'll show you a bit of that as well. Then I do stapler hemorrhoidectomy, that's called minimally invasive surgery for partial prolapse and hemorrhoids, MIP. I have a girl who is a dancer. She wants an operation of the gallbladder appendix without any scar at all. You go through the umbilicus, the natural scar. You insert a device and go through that you can operate. That is still single incision laparoscopic surgery. I do that as well, those who ask for. Then, this is to show the training program we have. We conduct every 3 months, we have a stapler MIPS training program. Surgeons from different parts of India, they come for training from Calcutta to Kerala. This is to show the sort of obesity surgery we do. This is only just to show you what mini gastric bypass is all about. I'll go to the mini gastric bypass in detail when I talk about obesity. So I'll skip that for the time being. Yeah. There's a radio frequency ablation for varicose veins. In the past we used to cut all over the leg and made a mess of it, and you get 25% recurrence, 20 to 25% recurrence. This is one of the amazing procedure. A technician can do it actually. When I don't have time, I insert the needle into the vein under vision using a venous Doppler. You have seen the venous Doppler, and this gives 95% of the venous problem is incompetency of the two veins, saphenofemoral, saphenopopliteal. Then obviously the perforator incompetence below the knee actually. This is a very simple procedure. And that is a probe. And under vision, you can see the probe going in. That's at the tip, it has got the active filament. That's almost near the junction. That goes into the superficial epigastric. This is an instrument. It's called venous closure. The temperature goes up to 120 degrees. And the vein is with the elastin and collagen. And with that temperature, it sticks. And that cauterizes diathermy, the entire tract containing filthy granulation tissue. That is brushed and washed out. The internal opening is closed using a stapler. That's the way. That is the way you diathermy using a monopolar diathermy. That's a tract you can see.
Mommy.
Burning out. Yeah. Burning tract with the unipolar diathermy.
Why is he fixing his phone?
Then you close the internal opening, wash out, and leave the external opening. That is. This is video assisted anal fistula treatment.
Why is he showing the problem?
This is single incision laparoscopic surgery. That's an young girl. And you put a 2 centimeter incision in the umbilicus. That's a natural scar. And you go in. There is a device placed. It's only a simple procedure I've done. See, the advances which you find today is something which you cannot catch up. It's so fast advancing.
Appendix.
That's the appendix. You can do the same thing. The same way you can do gallbladder, you can do hernia, you can do sleeve gastrectomy. There are surgeons who specializes only in cells, single incision, single port it is called. There is one fellow in Apollo, Cochin. His name is Palani Velappan, something like that. Rajkumar Palaniyappan. That's all. When you do an operation like, just imagine after a cholecystectomy, that's what you see. After 3 days, you can't see anything unless the patient reveals that I have had a cholecystectomy 5 years back.
Why?
This is a inguinal hernia operation. All hernias, our big, our small, we do it only laparoscopically. We don't open the abdomen at all laparoscopically. This is a technique called tab. You go inside the abdomen and transabdominal. See, the peritoneum is open. That's obviously an edited version. Yeah, you can see all those vessels, the common iliac vessels, artery. That's a pelvis, in fact. You are inside the pelvis, but you go pre-peritoneally. You place the mesh before the peritoneum. That's the defect. You place the mesh pre-peritoneal. That's one technique of inguinal hernia operation. There is another technique called TEP, total extraperitoneal. You don't go inside the abdomen. This is very logical, isn't it? The incision comes from inside out. In the past, what we were doing, we were cutting through the innocent muscles, go from outside in. So here what we do is, you go inside, reduce the hernia, put a stopper. That is what we do. So the hernia is reduced, and a stopper is put. That is the tap procedure for hernia. This is another tap procedure. That's a direct inguinal hernia, bilateral on one side.
My arm hurts.
Make it faster. That's iliac vein. Just lateral, that's the hernial sac. You don't go inside the abdomen, you stay outside the abdomen. It's a total extraperitoneal approach. So we have a lot of things to say about obesity. We'll skip these things faster.
Just fixing it.
Yeah.
That's we fix the mesh on either side. The size of the mesh is 15 centimeter length, 10 centimeter in width. Yes. How can you get a recurrence? Properly done, you never get a recurrence. So you are putting a cord there. You cannot, the hernia cannot escape through any openings. This will cover all the 4 openings: the femoral hernia, obturator hernia, direct hernia, and indirect hernia. Whereas in open surgery, you can only deal with one hernia. So this deals with all the hernias.
You
can do the same for rectus diverticus.
Divertication of the rectus. Again, yeah, same thing. You go inside the abdomen, you bring it closer, and put a mesh also. Any abdominal hernia, divertication of the rectus. Yeah, that's very common with Indians, especially with the Keralites, Malayalis. Yeah, they have a very thin abdominal muscle, and they have a loaded fat in the abdomen. It's called the central obesity. High risk people for coronary. Now we'll go on to obesity. So what is all about obesity? What do we mean by obesity? Obesity is what? It's accumulation of fat. More than the ideal fat you can have. What's the ideal fat in ladies? More than 30%? No, must be below 30%. In men it should be below 25%. After all, you can say the weight more than the ideal weight when it increases by 10% more than the ideal body weight. That is obesity. If the ideal body weight exceeds 20%, you have a high cardiovascular risk, probably by 20%. How do you calculate obesity? There are many methods, but single parameter, if you are asked, that is BMI, body mass index. How do you calculate? It's very simple. The weight in kilograms divided by height in meter square. Roughly, if you say, I'm 170 centimeters in height, you reduce 100, that will be more or less your ideal weight. You are 190, 90 will be your ideal body weight. If you are 180, 80 will be your ideal body weight. Dr. Samad there, looking at me. Yeah. And obviously weight circumference in men more than 90%, 90 centimeter, and women more than 80 centimeter. Then the waist hip ratio and all that, that's all lot of things which you can look up in any textbook, net you can get. I'm going to concentrate in the surgical management. So underweight below 18.5, normal 18.5 to 24.9, make it easy, I'll say 25, and BMI above 25 to 30 would be considered overweight. Above 30 is obese. Above 40 is morbid obese. Above 50 is super obese. Above 70 is super obese. You can go on saying whatever you want. Central obesity is seen among Asians, especially among Indians, more so with Malayalis. I don't know why. And if you take 10 countries of highest population, if you take China, 131 crores, that is 1.31 billion people. Out of 7 billion, 1.31 is in China. India, 1.21, slightly more. Then comes United States and 10 countries, China, India, United States, then Indonesia. So 1.5 billion people are obese or overweight all over the world. I would think 1 billion are overweight and 500 million are obese all over the world. In spite of whatever awareness we give in India, it's not that high, but it is something like 7 to 8% obesity. We have something like 80 million people are obese, and in America, almost 95 million people are obese. 1/3 are obese, 30% obesity. That's the statistics. What you see in violet is America, that is 92%. And the red is India, 84%, and China, 67%. And these countries constitute half of the world obesity. And Punjab, you wouldn't believe it is 30%. I'm not happy believing 30% of the population Punjab are obese, but that's the statistics. But in Kerala, something like, I would have thought something like 15%. I wouldn't like, when you look at their face, you think he's at the most 14 centimeters. Cholelithiasis, colonic cancer, renal problems, erectile dysfunction, urinary incontinence, etc. Breast cancer is also included. Skin stretch marks, lymphedema, acanthosis nigricans, thick skin, black skin, velvety skin, that might be a forerunner of a malignancy.